around this facility today. And I want to thank you, Valerie, for you and the team for hosting us here, both starting with the City of Boston and now with this mass vaccination site. We're obviously thrilled to be here today and to have a chance to tour the site. And before I get into some of the details of that, I do want to give a quick update on the COVID numbers. Yesterday, the Department of Public Health reported 1,413 new cases out of about 94,000 tests. 689 individuals are currently in the hospital being treated for COVID, and 183 are in the ICU. The 7-day average positivity test rate for COVID in Massachusetts has dropped to about 1.77%. We're clearly making progress on driving down the rates of COVID here in Massachusetts, and as of today, there are only 14 communities that are designated as high-risk communities. That's down from over 230 back in the beginning of January. And on vaccines, over 2.2 million total doses have been administered here, including 1.5 million first doses of Moderna and Pfizer, and 32,706 J&J doses, and almost 785,000 people in Massachusetts have been fully vaccinated at this point. We remain a national leader in getting first doses and total doses to our residents. We're number one per capita in the country among the 25 states that have more than 5 million residents for both first dose percentage of the population and for total doses administered. And we're number 3 in the percentage of our black residents with at least one dose. We first dosed 74% of our individuals that are over the age of 75, and almost half of those over the age of 65 have received at least one dose as well. Sites like this one here at the Reggie Lewis Center are doing a terrific job of delivering vaccines safely and effectively and efficiently to people here in Massachusetts. Before it became a mass vac site, the state collaborated with the City of Boston to open the Reggie Lewis Center as a community vaccination program. And I want to thank the folks from the Boston Public Health Commission for all their work, not just in setting this site up, but in working day to day, hand in hand with us for over a year here as we have all battled COVID-19 in the City of Boston and across the Commonwealth. The Reggie Lewis Center obviously is a known community location. It's a place the Lieutenant Governor and I have been many times for a variety of events over the years. Isn't this where Tony Richards' dad's basketball program operates out of? Yeah. And over 13,000 people so far have been vaccinated here since the beginning of this process. Current capacity, as the folks at CIC Health said, is around 1,200 appointments, which we expect will get over 2,100s on weekdays and hopefully over about 1,700 on weekends starting next week. The location provides a unique opportunity to do targeted outreach to surrounding neighborhoods, which include communities that have been hit hardest by COVID-19. And half of all the new vaccination appointments that are released each Thursday are reserved here for local residents to ensure that they have access to vaccinations. And as part of the Commonwealth's Vaccine Equity Initiative, CIC Health, along with the City of Boston and many, many other community-based organizations, have been working collectively, as Atul talked about, on a robust outreach operation, which includes a canvassing program to disseminate printed information materials in multiple languages. And with these partners, CIC Health also mobilized a phone bank, which was in operation before, but not now, which has booked over 1,000 appointments for local residents on outbound calls. We're continuing to make progress in reaching communities of color to increase awareness of and access to the vaccine. And places like this, which vaccinates among the highest proportion of Black and Hispanic individuals among our mass vaccination sites, is a great example of that. We've also launched Trust the Facts, Get the Vax, which is a public awareness campaign which began last month, and the Department of Public Health is currently working with Archipelago Strategies Group and Healthcare for All on targeted outreach efforts in 20 of the most disproportionately affected communities. Among other things, that will involve hundreds of thousands of personal door knocks, probably done in most cases by people from the community, to encourage folks to get vaccinated and to provide whatever support they might need to get to wherever they need to go to get vaccines. This morning, 40,000 first dose appointments went online for the mass vaccination sites, and they were booked quickly, and the website worked the way it was supposed to. And this is the last Thursday where the mass vaccination appointments will be made via the VaxFinder website. Tomorrow we launch a new pre-registration system for the state's 7 mass vaccination sites. That includes half of the appointments that get booked here at Reggie Lewis. Eligible residents can visit mass.gov/COVID vaccine to pre-register and to receive a notification when there's an appointment available for them to book. This tool will make the booking process simpler and easier for people, and we plan to add more sites to the pre-registration program in April. If somebody isn't able to use a computer, they can call 211 for assistance in booking an appointment, and once an appointment becomes available, they'll then receive a notification and have 24 hours to accept that appointment. But everybody needs to remember that even if you use the pre-registration system, it could still take several weeks for eligible individuals to receive a notification that there's an appointment available for them. We're still receiving limited doses from the federal government every week, so there are only so many new appointments that can get posted each week. Even if you pre-register, you can still continue to seek appointments at other vaccine locations. So remember, there's about 170 sites across the Commonwealth that are open to all groups that are currently eligible. Overall, there will be thousands of appointments available over the course of the next week. The Commonwealth receives about 250,000 first and second doses each week from the federal government, and the mass vaccination sites will administer about 83,000 doses across first and second appointments. Local boards of health and regional collaboratives will receive about 63,000 doses. Community health centers, healthcare providers, and hospitals will receive about 80,000 doses. And the federal government will continue to provide doses directly through its retail pharmacy program to CVS. And this week, we expect that they will receive about 95,000 doses that can be booked for appointments in that program. We obviously have a lot more capacity to administer doses than we currently receive each week. At least 2 or 3 times the capacity that we receive each week from the federal government, and we certainly hope and anticipate that the game will change with respect to supply sometime in the not-too-distant future. Today also marks the first day that K-12 educators, K-12 school staff, and early education workers are eligible for the vaccine. This eligibility group can get a vaccine at any of those 170 sites that are now open to the public. Yesterday, we announced 4 days that are being designated at the 7 mass vac sites where appointments will only be offered to K-12 educators, K-12 school staff, and child care workers. Those dates are Saturday, March 27th, Saturday, April 3rd, Saturday, April 10th, and Sunday, April 11th. To sign up on one of those dates, educators should use the pre-registration system that's launching tomorrow and attest that they are a K-12 educator, a K-12 school staff member, or a child care worker. And other providers are encouraged but not required to also restrict appointments on these dates to the same groups as well. As I said before, we continue to be a national leader in our ability to get vaccines safely, effectively, efficiently, and equitably to our residents. But this program cannot move fast enough, and people that are eligible haven't been able to book an appointment so far are obviously disappointed and frustrated by that fact. We've taken a number of steps to make the process of booking an appointment simpler, and the pre-registration form in particular will certainly help streamline that process. But in the end, how fast we can deliver vaccines depends on how quickly the federal government can ramp up its production program and its distribution plan. And it could still take several weeks for folks to secure an appointment even after they register. We obviously appreciate the patience our residents have shown with respect to this process, and everyone who wants a vaccine will ultimately get one. And I would just remind everybody that we still have dosed so far 2.3 million doses across the Commonwealth, and at this point, more than 785,000 people are fully vaccinated. We are making progress on this. We certainly hope that federal supply dramatically improves sooner rather than later, because as I said, we have a ton more capacity to deliver vaccine than we actually have supply at this point in time. I want to thank the folks from Reggie Lewis again. I want to thank the folks from CIC Health, and happy to take questions for me or for any of the other folks who are up here. Hey, Sharman, I can't hear you. We believe in a program that was established by our Vaccine Advisory Board that the two fundamental objectives with respect to vaccination priority here in Massachusetts should be the preservation of life and the preservation of the healthcare system that preserves life. And that's why we targeted a number of the communities that we targeted to begin with. We also said we wanted to make clear that equity would be an important focus for how we move forward. And if you think about many of the groups that we focused on, which most other states didn't, straight out of the gate, it's pretty clear that we took that idea seriously. There are very few states that chose to vaccinate straight out of the gate residents and staff at congregate care facilities that serve homeless people, folks with developmental disabilities, or folks with mental health issues. Very few states, I'm not sure of any, that chose to focus straight out of the gate on personal care attendants or on home health care workers. Very few states straight out of the gate chose to focus on making sure that inmates and correctional officers in the correctional system had a chance to get vaccinated. And very few states straight out of the gate put the amount of work and effort that we put into doing all we could to make sure that staff in senior care facilities, long-term care facilities, and assisted living facilities got vaccinated. And that all took time, but it was important work, and it made it possible for us to consistently overperform national averages on delivering doses to some of those most vulnerable populations. And it's part of the reason why 75% of our over 75 population, which is the most vulnerable population, has been vaccinated here in Massachusetts. And it's also why almost 50% at this point of our 65 and over population has been vaccinated here in the Commonwealth. We continue to believe that we should be focusing on preservation of life and preservation of the healthcare system. To align our program with the decision that the President made to include teachers and educators and educating staff and child care workers, we incorporated them into the current eligibility model starting today. And we set aside 4 days at the end of March and the beginning of April, when I'm hoping we will have a lot more J&J vaccine, which can be a one-dose solution, or more of the two-dose Pfizer and Moderna vaccine, so that those days can turn out to be very productive days for educators, child care workers, and K-12 staff. But I am not going to be in a position where I take vaccine away from people who are extremely vulnerable, who have multiple medical conditions and are over the age of 65, to give it to a targeted population. We're just not going to play that game. They were looking for their own vaccine and to not participate in the process that everybody else participates in. In addition to that, every state in the country is using provider organizations, mass vac sites, pharmacy chains, and community health centers for the vast majority of its vaccine distribution program. The Biden administration is using, through FEMA, is using mass vac sites, bigger mass vac sites than our mass vac sites, as well as retail pharmacy chains and community health centers to distribute its vaccine. The process we're pursuing here in Massachusetts is completely consistent with the process that's being used in virtually every other state in the country. Why? Because it's effective, it's efficient, and it gets lots of shots in people's arms in a short period of time. Say again? First of all, even the CDC has said that teachers don't need to be vaccinated to be educating kids. And by the way, tens of thousands of teachers and hundreds of thousands of kids have proven here in Massachusetts since August that if you follow the rules and the mitigation strategies that were developed by a panel of experts and pediatricians and educators that our folks at the Department of Elementary and Secondary Education put together, you can teach kids safely in person. The Lieutenant Governor and I were up in Gloucester last week to celebrate the 101st day in a row of in-person education in the city of Gloucester. Now, Gloucester has done a terrific job of making sure that their kids throughout the school year have had access to in-person education. And Gloucester is a multilingual community. It's a community that had some very tough days, weeks and months associated with COVID. And because of the mitigation strategies that they put in place, and because of the guidance that they got from their own people and from the folks at DESE, they have succeeded. But they are one of many stories across the Commonwealth that demonstrate that if you follow the rules and you pursue the mitigation strategies that have been recommended by a whole variety of experts in the space, you can educate kids in person and do it safely. And that's all we're looking for.
Governor, do you think the fact that teachers' unions are not reflecting, leadership is not reflecting the rank and file in the disconnect there, and do you think they're being selfish?
I can't speak to that, but what I can tell you is the Lieutenant Governor and I have been in and out of a bunch of schools over the course of this year. And the one thing I can say I take away from every visit that I've made, and I think the LG would agree with me on this, is the joy and the sense of gratitude that the kids and the teachers and the administrators feel toward one another about the fact that they found a way to make it work. And in many respects, that seems to me to be the greatest challenge of all. I mean, what Gloucester is doing is a little different than what Salem is doing, is a little different than what some of the other communities we visited have been doing. But the single common element that all these communities have that have had their kids in school all year is they've followed the guidance and the mitigation strategies, and they've been very creative about how to make it work in their building for their kids, their staff, and their teachers. Well, I certainly think that this idea of Archipelago and Healthcare for All are two very well-known organizations in Massachusetts that have done a lot of great work around outreach, especially as it relates to healthcare. I do think this whole idea of literally door-to-door type activity, sort of the equivalent almost of a political campaign, and working with key community-based organizations and faith-based organizations, trusted partners in those communities, has got to be a big part of how we reach people and then encourage them not only to get vaccinated, but if they say to us, I need a ride, or if they say to us, there's some other constraint that's associated with getting vaccinated, that we figure out what it is. If they say, I just don't want to go for another 30 days, that we create some sort of a tickler that makes it possible for us to get back to them 30 days later. The call center that you folks are running here with the 50% of the vaccines that you have available for people in the community, the outbound approach you've been pursuing, the way you've gone about doing that is certainly part of the strategy as well. But I think, I've said many times that I think guys like Alberto actually has a lot of really interesting ideas, which we've been busy stealing, about how to make this message deliver and how to make it work. But I also think that one of the things that makes many of us, including me and the Secretary and the Lieutenant Governor, so frustrated about where J&J is at this point and where we thought they were going to be, is they don't require the deep freeze and the overnight prep and the thaw process that's associated with the Pfizer and Moderna vaccine, which means, and it's one dose, which means you can use it on a mobile basis to visit community health centers, senior centers, senior housing. There's so many things you can do with a vaccine that doesn't require all of these very particular storage and prep issues that come with Pfizer and Moderna on a mobile basis. And the fact that it's one shot means you don't, when you're out there vaccinating, at a senior center, or you're out there vaccinating at a community center, or you're out there vaccinating at a public library. You don't have to set up a second appointment for all those people, and you don't have to worry about whether or not you've thawed enough the night before, or you put enough in, you mixed enough over the previous 2 hours to vaccinate people. And I really hope we do see a big J&J supply, because I'm sure these folks and the other folks who are working with a lot of these community-based organizations will have some really great ideas about how we can really leverage that, especially in some of the communities where people have a hard time getting to a provider, much less a site. Well, keep in mind that people need to be eligible, right, when they sign up. It's going to go online tomorrow morning. I'm not exactly sure when, so it's going to be online tomorrow morning, and people should just check the website, and it'll be there. There is a first come, first serve element to it, but remember, it's also going to try to make sure that it sends you to a place that's consistent with your geography based on available appointments at that location. Anybody who wants to register can register, okay? But the folks who are obviously going to be dealt with initially by the site will be those who are currently eligible. So take me, I'm 64, right? I'm not eligible. If I sign up tomorrow morning, I won't actually get into the queue, right, until I become eligible, which will be when my age group becomes eligible to get vaccinated. I think it's more going to be some sort of an algorithm, the way they'll tee it up originally for that, because I'm not eligible. I don't think it's going to work that way. I think if you sign up before you're eligible, you'll just get rolled into the process and identified. Do you know the answer to this? I'm going to have Secretary, I'm familiar with the proposal. I'm going to have Secretary Sutter speak to it.
I think I heard most of that through the echo. So last week, this is Thursday, might have been the beginning of this week, we had a meeting with the Springfield COVID task force and some of their state representatives about the City of Springfield's proposal. It's exactly what we would want to see from the 20 disproportionately impacted communities, like their ideas about how to bring vaccine to their community. In fact, we're reaching out through Curative to the city about opportunities to partner together. And the city, all the disproportionately impacted communities get an allocation separate from all other allocations of vaccine, from 400 up to 1,000. City of Boston gets 1,000 because it's obviously the largest city, to also start to plan how they want to use the vaccines. The city wants, I think, double what they're currently getting. And again, we have this constraint of supply. So looking for the CIC model here at Reggie Lewis is one that we're taking the lessons here to talk to some of the other mass vac sites about opportunities to reach out to their communities as well. So as the governor often says to you, more to follow soon.
Say again, Matt. I think, well, I mean, every state is pursuing a different approach to this. The one thing we don't want to lose sight of with respect to what we do here in Massachusetts is this requirement to pay attention to the issues around equity, okay? And I think that's going to be something we'll continue to discuss with the advisory board that we've been working with on this. But part of the reason why it's set up the way it's set up was to answer questions and to be sure that we have programming and prioritization in place to deal with some of the communities and some of the people in those communities and some of the people in particular roles of employment that have been hardest hit by this to begin with. Who's follow up on the meeting? Yeah.
Governor, one more follow-up on an earlier question. Should you, as a 64-year-old, be competing with your 25-year-old son or whatever? It does seem like there should be maybe some breakout. Are you thinking about that at all?
Yeah, I mean, one of the things we're trying to figure out here is, and we now have more practical experience, which helps, is, how much of these various communities will come because it's available. How many of these folks need to be sort of courted a little bit with respect to getting them there? And then when do you really get to the point where you can move to the next group and feel like you got everybody who was up for it in the group that was already eligible? And we're starting to figure some of that out. But with respect to whether, somebody who's my age or somebody who's 25, I don't think the way ours is set up, it would work that way. And I certainly think that when you get to the everybody group, which is that what you're talking about? Like when everybody's eligible?
I think we're all lumped in together. I mean, the 64-year-olds are 25-year-olds.
Well, remember, hopefully by then we're going to be at a point in time when if we can choose to believe a lot of what we're told by the feds and others, by the time we get to that point, there should be enough vaccine available for us to really max out the capacity we have, which means the distance and the time between, when that group were to start and all the folks who are in it get vaccinated probably wouldn't be that long. Again, it's going to depend a little bit on whether or not we think that's creating issues around equity. And remember, the preservation of life issue for the over 65 population and people with serious medical conditions is a really big deal, and that's why we started there, along with some of those key healthcare communities and some of those congregate living populations where both the residents and the staff were people that we considered to be significantly at risk. Well, it's certainly not. I certainly don't do it every year because it looks good. The Granite Telecommunications down in Quincy started doing a shaving event to raise money for cancer research at Dana-Farber. And I knew the CEO there because I used to work in the neighborhood, basically, when I was at Harvard Pilgrim. And he asked me after the governor's race if I would be willing to come down and participate in this thing. And he said, if you do, we'll make a big donation to the program if you choose to participate. So I did. And, there are literally thousands of employees of that company and family members of employees who do this. And they've raised more than $50 million doing this over the course of the last 7 or 8 years. And this year they're doing it virtually. And they think they're going to raise $7.5 million for Boston Children's Hospital. And my experience this time was a lot different than it was last year. It was just me, Kevin Churchill, who's the CEO of Boston Children's, and Rob Hale, who's the head of Granite Telecommunication. The three of us, socially distanced, in the same lobby where usually there's hundreds of people and hair cutting and buzz cutting going on all over the place. But they're still going to raise a lot of money this year. And I know this doesn't look very good, but it doesn't look very good for a short period of time, and it grows back. And it's a moment and an opportunity for those of us who, thank God, don't have cancer to understand what it might be like to have cancer and to lose all your hair and to end up in a situation where you feel a little uncomfortable about the way you look. So I don't mind doing it. I like doing it. No, we're looking to have people go sort of in the order that they sign up. I mean, like I said, 75% of the over 75 population at this point has gotten a first dose in Massachusetts and obviously been scheduled for second doses as well. And I think in most states that have done a pre-registration model, I mean, they vary a lot from place to place, but people generally, work their way through these groups, and when they get to the point where they feel like everybody who really wanted to get one, they move to the next group. And if folks do want to hop in at that point on a pre-registration, they can, but then they just land in the list, the same place they would have landed otherwise as an eligible beneficiary. Say again? I don't know. It depends. I mean, they'll start remember, they're going to start rolling these out next week. And so they'll probably start booking things sending out notices to people the beginning of next week for the end of next week, and then rolling forward from there. The other thing I would remind people is there's still a bunch of other places that are going to continue to vaccinate people in Massachusetts. Hospitals and health systems are the largest player in our vaccine distribution system in Massachusetts. The regional collaboratives and other sort of locally operated initiatives are still going to do 65,000 vaccines a week. The community health centers are going to continue to do significant numbers of vaccinations, and there's a bunch of different places, and the pharmacies are going to do almost 100,000 next week. So there are a lot of other places and channels through which people will continue to get vaccinated in Massachusetts. We've been talking to the neighboring states about this, and I expect that there will be news movement, whatever you want to call it, on that relatively soon. We did adopt the CDC guidelines on travel for those who've been vaccinated, I think this morning or last night. Yeah. Say again? I think if people want to check it when they get up, that's a fine idea.
Thanks, everyone.
Thanks. And thanks again to Reggie Lewis and to the folks at CIC. Really appreciate it.